Welcome to Between the Lines, a podcast hosted by former world number one Laura Massaro and performance coach Ahad Reza.
We break down what's really happening in high-level squash across the technical, tactical, physical and mental realms and help you translate it into action.
You will hear match analysis, guided insights, coaching demonstrations, and conversations with some of the best minds in sport.
But this isn't just about the theory. It's about growing a community of curious players and coaches dedicated to unlocking their potential together.
So if you're ready to train smarter, think deeper, and play better, join us Between the Lines. Hey everyone, quick interruption. If you've ever felt stuck in your squash, you're training hard but not improving fast enough, Laura and I built something just for you.
Our new online coaching community gives you the structure, clarity, and live access to us every month so you can finally break past plateaus without paying private coaching fees.
If that sounds like what you need, just email me at ahad@arperformance.com and I'll help you get started. Now, back to the program. Folks, Laura and I just had a fantastic conversation with one of her old physios, Ian Horsley. And Ian's a decorated physio, 25 plus years of experience, an expert with the shoulder in particular, but so many other things. And he dropped gems through this podcast. Laura, what was one thing that really stood out to you?
Yeah, I think just the depth of knowledge that Ian gave in the podcast was pretty phenomenal. I speak about how calm he is and, really tried to pin him down on a few things. And he, there's so much around physio that is obviously individual, but his underlying tone for me was you have to work slowly and you have to work on stability before you can build strength. And that was so interesting, actually. So I think there's going to be so much to come from this podcast for everyone listening. What about you, Aha?
Yeah, so there were actually two things. I was going to mention one, but a second one popped into my mind. One was a couple of the exercises he gave, which directly relate to the stability piece that you mentioned. Specifically, he talked about the power of the dead bug and the bird dog. There was one more, but that was more complex. So folks, you have to listen in for that one. But it's about ensuring that the pelvis is stable, the glutes are firing, everything is firing. The other thing that was really interesting was how he spoke about how everything is interconnected. And the example he gave of if the big toe is not functioning, the shoulder is going to have issues. It was really cool how he spoke about the interconnectedness of how the toe affects the next piece and the next piece and so on. So this concept of kinetic chains was also fascinating to me. But folks, if you want to dive into this, stick around. You're going to get started now. There's a ton to take from it. Bring your notepad and get started.
Today, we are delighted to welcome Ian Horsley to the Between the Lines podcast. Ian brings nearly 30 years of experience as a physiotherapist in the UK with an impressive career that spans elite sport, education and clinical practice. After completing his studies, Ian founded Back in Action, which I've been to a few times, his own clinic in Wakefield, which has been serving the community for 26 years. A large part of Ian's career was dedicated to England Rugby Union, and from there he went on to work with the English Institute of Sport as a lead physio for the Northwest, which is where our paths crossed. Alongside our squash physio Jade, Ian was a key figure in my rehab and performance team, and it's calm, collected and reassuring, and he always made me and countless other athletes feel like everything was going to be okay. Ian is internationally recognised as a shoulder specialist, and in his career has helped many athletes navigate through tough injury patches. His work with the EIS took him to multiple Commonwealth Games and Olympic Games with Team England and Team GB, supporting world-class athletes across a range of sports. Ian was one of the physios present at my medal-winning run at the Commonwealth Games in 2014 in Glasgow, and he has worked with several different teams and sports, including England football, which is soccer to those across the pond, and worked with other clubs across in Canada, like the Toronto Wolfpack. Beyond the treatment room, Ian continues to give back through teaching. He's a professor at Salford Uni and is serving as the chair of Education Committee for the European Society of the Shoulder and Elbow Rehabilitation. It is such a pleasure, Ian, to have you on today. Thank you for joining us. That was a long intro. How do you feel?
Well, you can see, as I said earlier on, you don't get this great without being old. So to do all that takes a few years to get all that under your belt. But yeah, thank you for that.
Yeah.
Feel like I had to do my research, and I wanted to do it justice with all of your many accolades. So thank you so much for joining us. And I guess the first question would be, what is it about being a physio that you love, and why the shoulder?
So why do I love being a physio? Because in the main, with sort of straightforward physiotherapy, we get the results with our patients and athletes through our endeavours. So using hands-on skill and exercise therapy to improve patients. We have the luxury within physiotherapy to spend time assessing patients. Even with an NHS setting, you'll get between sort of 20 and 40 minutes on an initial assessment to assess a patient who comes in, so we can start to find out all the information that we need to build a picture of what's going on with them. In addition to that, now we're having an extended scope within physiotherapy. We can do things like do some ultrasound scanning around joints, which helps with some of our diagnosis. And then we have, certainly in the UK, we have got the capacity to prescribe, and off the back of that we can inject as well. So we can provide a one-stop shop for most musculoskeletal injuries within physiotherapy. It's like a challenge. I think I always treat seeing a new patient like a game of Cluedo. You get some information, and at the end of the game, you've got to decide whether Colonel Mustard did it in the dining room with the lead pipe, and hopefully that's how we come up with some form of diagnosis with our athletes and patients based on taking all the facts into consideration. Why did I get into shoulders? Well, as you said earlier on, I was lucky enough to work for best part of 15 years with England Rugby Union at various levels. My final years there, I was part of the wider support team for England Rugby Union in 2003 when we won the Rugby World Cup. So lots of shoulder injuries within rugby, and early on when I started, there was an injury audit done in professional rugby that showed there was a high recurrence rate of shoulder injuries in rugby, and I thought, that'd be interesting. Let's see if we can work out what happened there. My supervisor at the time, Krista Rolfe, said to me, "That's fine. That'll only take you a year in to sort that out. We've got all this data, so no problem." Anyway, 7 years later, I managed to complete my PhD. And stayed in that sort of sphere. Specialising in shoulders since.
Wow, I mean that's fantastic. How has that translated to squash when you work with Laura? Did you find a lot of lack of mobility and all sorts of wonky stuff in Laura's shoulder?
It's good. Yeah, she's aggressive like a forward, is Laura. So, so that helped the years in rugby. The thing is, it's the biomechanics are the same, whether through sports, and then just understanding the specific requirements of a sport. So, within squash, there's not a lot of overhead done, which is different to tennis and badminton, but again, so understanding the mechanics of playing the shots and the movement around the court in squash then helps. You can start to work out rehab protocols. You can sort of sometimes work by watching some of their videos back when athletes get injured about what actually went wrong for them to present with some form of shoulder pain, and then lots of things you can, there's lots of ways into the shoulder as well. Sorry.
Yeah, I was just going to say, correct me if I'm wrong, but although a shoulder specialist, I don't think I really did see you much for any shoulder issues, really, did I? It's not, I know Nick had a shoulder surgery, didn't he? But it's not the go-to injury, is it, for squash?
No, it's not. Yeah, that's what I specialise in. But I'm more than a one-trick pony. I'm pretty good at seeing the rest of the body. And to be fair, when we're considering what goes on within the shoulder, a problem at your big toe joint can influence how your shoulder works and be part causative of getting traumatic shoulder pain. So you need to know
an interesting story there about my big toe. Do you remember?
Yes, yeah.
I had an injury. Let's tell I had the story, and for everyone else listening, I had an injury where I was basically struggling to walk. No joke. I'd gone to play the Irish Open, I'd lost to Alison Waters, and I basically couldn't put my foot down to strike the ball. Came home. I think we had like maybe a week turnaround with Jade to go to the Games. It wasn't long. Saw the doctor. The doctor said I had remind me and the inflammation of the two bones under the big toe. Sesamoiditis. And Ian just happened with Jade, our physio. You were in that day. You went, let me take a look at it. Gave my big toe a wiggle and went, you've got a stiff big toe joint. And I went, no, this is agony. I mean, I can't lunge. And Ian's like, yeah, stiff big toe joint. I've seen footballers not be able to kick a ball with this. I'm like, oh my God, really? What do we do? He went, what was it? An injection to lubricate the joint, 2 days, non-weight bearing, and you're good as new. Oh, wow. So you had an argument with the doctor, didn't you? The doctor didn't want to inject my big toe because he said that what was it, one in a million chance that something could go wrong, and that he didn't think it was a stiff big toe. But we went with it and was like, what's the worst that can happen? At the end of the day, they injected it. You will not believe. Like 24 hours later, I was walking pain-free. It was unbelievable. Wow. Played the Europeans, never had a reoccurrence since. Like, it's bonkers, isn't it?
Wow.
And that's what's good about being a physio, stuff like that.
Yeah. Just stuff that, I mean, there's no way that I guess you sort of know that until you've been through an injury where you've treated an injury like that before, and someone maybe with more experience, I guess, has said to you that's a stiff big toe joint and not sesamoiditis or whatever.
Yeah, it's about understanding the cause of stuff. So when it's related to trauma, if you had your toe stood on or something, that's easy to understand. But doing what you always do, why would you suddenly present with it when there was no real mechanism? And so it's trying to work back. It's a bit like taking your car to the garage because you've got a bald tyre. And the problem's not with your tyre, it's with your tracking. So with you, your sesamoiditis was a bald tyre and your tracking was your stiff big toe.
Yeah.
Interesting. I mean, you guys have said so much right now that I want to jump into. The first thing Ian, you said was that the big toe can impact the shoulder. Can you dive into that for a second? Because I think this understanding of mechanics and how everything tracks and the chains and all that is really fascinating.
So it's part of the kinetic chain, and there's the song that them bones, that your knee bone's connected to your thigh bone's connected to your hip bone. It's true. So to shorten it, really, not to bore everybody stupid, but if your big toe doesn't bend back about 65 to 70 degrees, so coming up like that.
I got to assess mine right now as we're speaking.
Okay.
I'm lacking a bit.
So that means then that you can't get your hip into extension, so you can't properly get your leg behind you, which then means that your glutes will be insufficient, and that can cause instability around your pelvis and low back, which then can transfer up through your thoracic spine, through your shoulder blade, and then into your shoulder.
Wow.
So interesting, yeah.
Holy moly.
Is there anything else on the back of that follow-up I had that you were...
I don't know where to start. I'm broken. No, this is...
I would say, like, from experience, Ian, and correct me if I'm wrong, like, obviously going back to the squash players, a lot of it comes from the hips, right? Because it's a one side. I guess the downside is that it's a one-sided sport. You constantly throw in your right leg. Different muscle build-ups on both sides. I mean, I don't know how many times I had my hip levels checked and adjusted, leg length, all of that stuff, rotation of pelvis, which obviously, again, affects up and down the body, doesn't it? So I guess that's, from a physio perspective, that's the sort of stuff that you kind of look into, always make sure is in check.
Yeah, it's quite interesting, and I've said, and you just reminded me now, I've said for best part of 20 years, I'd like to look and follow junior squash players through into senior, into professionalism from there, because what you do find is, certainly what I have found working with England squash, is the better squash players have got reduced hip internal rotation. Now, is that causative? Does squash make that happen? Or is that a necessity to make you a world-leading squash player? That's what we don't know. So if we can start off and look at the hip ranges of internal rotation of juniors and follow them all the way through their careers, the ones who have decreased hip internal rotation that go on to be better players, or vice versa, does just the art of playing squash give you decreased hip internal rotation?
That's very interesting. 'Cause, I mean, one of the things I remember always hearing is that you want to have an equal, or there's certain standards almost that you should have certain amounts of rotation around your joints in internal versus external and so on. That almost, I mean, my brain's trying to process what you just said in that, because I know you see squash players walking with externally rotated hips and feet all the time, right? It's kind of like the feet are pointed out a little bit. So you're suggesting that we don't know whether it's a correlation or a causation, like which one leads to being a better squash player. But that's so fascinating because I mean, my brain, based on everything you hear and read, would say, well, if you're super externally rotated, it's going to lead to more injuries. So you should try to manage that rotation and see if you can increase your internal rotation. So, like, how does that all come together? For my brain's not processing. I'm sure other people are probably thinking the same thing.
I just want, that so, it's good that you spotted that sort of 10 to 2 feet, as we call it, like that. That
Yes.
is symptomatic in anybody that you're lacking that internal rotation with it.
Yes.
Now, that could be due to soft tissue, or it could be due to bony change. Obviously, if it's bony change, there's nothing you can do about it. But certainly, when I was doing stuff with England squash, a lot of the time we were doing a lot of mobility work and soft tissue work to sort of increase their mobility around the hip. So some of the specific ligaments and capsule around the hip, and some of the muscles around the hip, just to try and get a little bit more of that internal rotation of the hip, because you need that to get hip extension.
Mm-hmm.
Okay, so they're coupled movements. So hip internal rotation and hip extension are coupled. If you're losing internal rotation, then you're going to lose hip extension. So you're going to have to compensate somewhere for that lack of movement in the chain.
So those exercises, if I kind of throw a couple at you, like what Mark used to give me, where it was kind of 90-90, where you're in a 90 degree with front and back knee sat down on the floor, and then you kind of reach over your front of your shin, maybe over your thigh, and then reach back behind. Is that working on that internal rotation? Trying to
what's a really nice and easy one, if you sit on a high bench, so your knees are bent to 90 degrees, hips are at 90. If you put your fist between the inside of your knees and then keep the inside of your knees on your fist and kick your legs out to the side, that's a really good way of self-mobilizing your hip, and depending on how...
Cramping in my hip flexors. What was that?
There you go. Yeah, there you go. Yeah.
For anyone who's just doing that as we speak, knees together, fist. Yeah. Kick your feet and heels out to the side while keeping your feet on your hand. Yeah. If you're cramping your hip flexors, is that show poor internal rotation?
It is showing that, probably more from an imbalance in muscles there from that, yeah.
Well, I mean, I'd expect nothing less after.
You have to get some of Campson's exercise out again.
I'm going to have to. Ahad, have you got a question?
Yeah, no, I think, the hips are obviously one. Do you see a lot of people, at least in squash, presenting with any other common injuries during your time with England squash?
I think, we had, I'm trying to think, to be fair, Laura did pretty well. Didn't have many major injuries, just the odd niggle and getting out of line, sort of with their pelvis and stuff, and then obviously the sesamoiditis. We had, Nick had an awful ankle, which probably, he soldiered on that last year to get him to the Commonwealth Games to finish his career there.
Yeah. His knee as well. And I mean, to be fair, I rolled my left ankle pretty badly 3 times. I think that's probably, ankles are probably a squash injury, aren't they?
And then the Beach had a shoulder. Nick had a shoulder. And then everybody else were getting hips. So James was getting hips. A lot of people are having hips. and having cartilage tears in the hips and having surgery for cartilage tears in the hips. That was probably the most common thing across squash, which more than you see in other sports.
And squash is so interesting as well because, I mean, it's like every sport has repetitive movement, obviously, but squash players, at least we think as squash players, or so we'd like to think, is that we put a lot of volume into our bodies. And you see the old school guys and the Aussies and so on and so forth, just running 400s. And then, they're like hip replacements later on and knee replacements and so on. What sort of methods and routines and stuff can people undertake now to mitigate some of the risk of big things like hip replacements and knee replacements? And, can you still have high workload and have proper prehabilitation exercises or, that sort of stuff? What are your thoughts on that?
So again, if we go back to the car analogy, it's about biomechanics and it's about optimal loading. So if we think about what's going on through the lower limb, when you're running, jogging, there's about 3 times your body weight per stride. If you're sprinting, it can go up to 8 times your body weight per stride. So if you're, let's say, lunging forward or doing a single leg squat, your hip, knee, and ankle need to stay in alignment over each other. What you'll often see with a lot of people, whether they're squatting or lunging, that their knees will drift inwards. And then we've got an alignment problem, we've got a loading problem from there, and then repeated movements like that will then cause repeated abnormal loads through different parts of different joints, which then create some form of injury and pathology. So it's about we talk about it's about coaching movements to start with, and teaching people how to move well, and then we can start to put load on that, and then we can start to put speed on that. But the quality of the movement, that alignment needs to be good.
Laura, can I follow up for a sec? Or do you have anything to press in? Like I think of a player like Mustafa Asal. I don't know how much squash you're following these days, Ian, but do you know much of? Have you seen much of Mustafa Asal's play?
No, I haven't. I've seen some of the others, but I've not seen Mustafa.
Okay, so he's super powerful. Goes flying into corners, into massive lunges, and when he lunges, his front knee usually sort of kicks out a little bit to the side. So, the foot's here, but then the knee's like off at an angle like that. So would you say then over time, he's just at a higher risk of injury then because there's misalignment, or is there some form of body compensation that some people might just get away with it? What do you think?
Yeah, this is, I think, where we need to be sensible in all things, but certainly in sports medicine, it is that some people have idiosyncratic movement patterns and they're fine with it.
Yes.
And then some people have them and that can be injurious. If you look at the way that Michael Johnson ran the 400 meters, it was like best in the world, but you'd never teach anybody to run like that. If you look at the way John McEnroe used to serve, massive weapon, but it was so stressful on his body. It's amazing that he, didn't get more injuries. So it's about, looking at, there's a saying, if you always do what you always did, you'll always get what you always got. So if for Mustafa, if that's what he's doing and that's repeated and his body's adjusted to that, that's fine. My initial thought with maybe he has a bit of a stiff hip, lacking hip flexion. And what tends to happen when you're stiff through hip flexion, your hip will drift out to the side. So when he's lunging forward, it may be stiff in the back capsule of his hip, and that's how he manages to make up for that. So our bodies are really, really good at sort of cheating our way to get the movement, and if it's adapts in the right way, it's okay. But it's that fine line, and he's not somebody who's come across my radar. I've been regularly injured, certainly from a low limb perspective. Yeah.
Right. Yeah, I think, and for people listening out there, are there certain protocols or assessments or tests or anything that people could go through and see, am I biomechanically sound or am I unsound?
So for me, in a sport where you're on your feet, a really, really good test is that ability to start off with for a single leg. Well, the basic to do 2-legged squat,
Mm.
Okay, so imagine with the chair behind you, so standing up and sitting down, and you want to make sure that when you stand up and sit down, your hips, knee, and ankles stay in alignment, that your knees don't come in and out. And then you can progress that to a sort of a 30-degree single leg squat. And what you'll tend to find there, you get knee drift in from there. So that's telling you we've got all sorts of problems from an alignment point of view, but you're also going to be leaking energy from the floor up. If your knee drifts in, then any power that you're producing is not going straight up or straight down into the floor to move you. It's leaking out sideways, will make you less economical. We can do the same looking at a lunge, that hip, knee, and ankle stay in alignment, and then we can progress those to a step down off a small step. Can you keep that hip, knee in alignment? They would be my go-to assessments for lower limb to begin with, and certainly relating to some sort of hip and low back pain as well.
Interesting.
Yeah, I sort of feel like that would be maybe the physio's way of kind of looking at alignment, and then probably giving some sort of prehab program based on that, which is obviously kind of, that's what you're paying for, that's the expert eye. But is there anything sort of staying on the same subject from your point of view that you would just be like, if you're an amateur squash player or a professional even for that matter, or a junior who wants to sort of stay injury free as much as possible, there's certain mobility exercises that are just a no-brainer when it comes to squash? Something that, you know, they could do 2-3 times a week. I mean, I'm always saying to our had about the Mark Campbell glute circuit is one, but more maybe from like a bit of a mobility, obviously. Anything from your perspective that's key?
So sort of hopping back to what I said earlier, so looking at that ability to do a lunge in front of a mirror and stay in alignment from there, or even, you know, a really more challenging thing, if you haven't got any equipment, is trying to do a single leg stand up from a chair.
Mm-hmm.
Okay, just on one leg, but more importantly, control the lowering phase as well, so you don't flop onto the chair. So again, going through range, but it's about looking at the requirements of the movements of the joints for your particular sport. Okay, and not thinking, oh, I've got to have whatever 140 degrees at hip flexion. Okay, because very rarely will you get into that range. Can I get into the splits? Okay, you don't need to get into the splits. So it's, if you're focusing on being on one sport, you need to have the control and strength for the movements and the sort of breakdown of the movements that you've got in your sport, and then thinking that anything that we do on our feet is single legged, so we need to train our legs separately. And again, I've talked about doing a lunge, but again, you don't just lunge forward. You can lunge, you can lunge at 45 degrees as you're going for a shot. So again, just breaking down the movements. So, going into front court and coming back. So we've got that lunging forward and slowing it down, and then coming straight back, and sort of moving in and out. So thinking about the requirements of your sport more than anything else, because you can be the strongest man in the gym, okay, and still be slow around the court.
So I guess what I'm taking from that is a little bit kind of get yourself in front of a mirror in the gym, do some single leg lunges, look at yourself in the mirror if your knees dropping in and out, and basically just do it slowly, dropping up, dropping down, and force your knee to stay in that alignment, and you're going to effectively be working the muscles that want to switch off to let your knee drop in and out. And that's the same for sort of like a single leg, sit down on the chair, stand up. You have to do it slowly to see where you're. I mean, it's what we say about technique as well. It's like if you just swing at 1,000,000 miles an hour, you've not got a clue what your swing's doing because it's too fast to know. So the way to work on technique is slowly to understand what your backswing, follow through, and impact are all doing, isn't it? And I guess it's the same with the body.
Yeah, and to move on from that, you want to make it functional, so you can do those, but you need a racket in your hand.
Yeah.
That would be the thing. Ideally it would be wearing your squash kit, being as true to what you need to do at the end. Okay, so you can train your body, because it is about training movement, not muscles.
Yeah.
Right. And so a couple of things actually popped up. The one thing you were talking about, Ian, where you mentioned, doing the splits or having 140 degree of hip extension. So sometimes I feel that people, and historically myself as well, sometimes get into the mindset of more is better, right? More flexibility is better, and so on and so forth. So at some point, is more flexibility or more mobility potentially even hampering us because the joints are too mobile and we can't maintain enough tension and stiffness, and we're maybe leaking energy as we move? Is that a possibility?
Yeah, I mean, there's a lot of, lots and lots of books, lots and lots of papers have been written on stretching and flexibility.
Mm-hmm.
And I think the only two agreed facts about stretching and becoming more flexible is that immediately after stretching, you'll become less powerful. And if you increase range of motion without increasing strength in that new range, you'll get injured more. So it's fine to gain range, but let's say let me try and get right for you. So let's say I can only straighten my elbow to there. Okay, and we do a load of stuff, and then in a couple of weeks I can get my elbow to there. But what I've got now, I've got about 30 degrees of movement that I have no control over because it's not being taught, my muscle's not being taught to do that. So suddenly that's possible area to be injured, and that can be any joint in the body. So by all means, increase flexibility for a reason, but you must increase the strength in that new range to protect your joint.
Got it. Well, I don't read enough research, to be honest. I see things on social media, and
I've got plenty of books here. I can send you.
I might need to get some recommendations from you. So I have tried to read some of the super old school stuff by, I'm gonna forget how to pronounce his name, Vershansky, the Russian guy, Verchansky. I can't. How do you pronounce his name? Do you know? You know who I'm talking about?
Yeah, I know what you mean, and nobody. I don't think
no one knows how to pronounce his name.
I can pronounce it, but we all know he means a Russian guy. Yeah.
Yeah, the Russian guy who kind of the father of plyometrics and all that kind of stuff. But yeah, outside of that, like the modern day, you see so many things. You have some people advocating for full range of motion, knees over toes, and to your point, building strength actually in those ranges of motion. And then you get other people who are saying, no, never go past 90-degree joint angles because you're just putting wear and tear on your muscles and ligaments and so on and so forth. Where do you stand on this debate? Or nowhere?
It's one of those things. It's horses for courses. Yeah, you're right. We used to say no knees over toes. It's likely to cause danger. It overloads you. Certainly overloads behind your kneecap a little bit more. But more recently, that's been accepted that you can get your knee beyond your toes. But again, it's about that ability to be able to control it. And again, if we're thinking about things, we want to look at the we want to look at that alignment, the hip knee alignment stay in a line with each other. And again, it's that are we getting some compensation somewhere else? Are we starting to get the foot going flat? So pronation to allow that to happen there. And if we have got a compensation, where's that? What is it compensating for? Is it a stiff ankle or a stiff midfoot or a stiff big toe or something like that with it? So, and again, it's we're starting to be. It's a bit difficult now because everybody's an individual, and we have overarching ideas like no knees over toes. And for some people, that's the right thing to say. Do not have knees going further than toes. But for other people, that will be perfectly okay. So it's the horses for courses. Looking at the person you're with, looking at their injury history, really. And being aware that if whatever you're doing, it's about having that 3-dimensional control of the lower limb.
Yeah, so there's not necessarily a right or a wrong blanket statement. It's each person has to assess their body, their history, their needs, their mobility, and how the kinetic chain, to your point, is compensating or not compensating appropriately.
Yeah, and I think, in this modern age where, there's so much information available on the internet and things,
Yes.
there's a lot of these overarching statements that people believe in or not. And as I say, for some people, knees over toes is fine. For
Mhm.
other people, knees over toes is not fine. You basically, to see what happens. If you're doing a lot of knees over toes lunging and you're getting a sore knee, well, we need to look at why is that's happening. And
Mhm.
again, is there a need? Is there a need for that? Is it, are you stiff at your ankle or stiff at your midfoot or stiff at your hip? So looking at what you need to do to mitigate that pain and discomfort.
Mm.
Yeah. I guess similarly to that sort of theme is what, when you're thinking about squash players, maybe more on an amateur level, because we're thinking about people who have maybe juniors as well, people who have got limited amount of time. Squash players tend to work at quite high intensity, don't they? And it's a game at the end of the day. So a lot of amateurs get on and they love to play and they just run around. And if you could say to, an amateur that for 10 minutes after every time you step on a squash court, you're hot, you're sweaty, you come off, and whether it's when you come off or you tell us what's best, whether it's when you come off or whether it's sort of when you showered and cooled down later at night, if they could give you 10 or 15 minutes to help with injury, whether it be some sort of stretching, mobility, foam rolling, theraguns, anything like that, yoga, Pilates, what would be your go-to to the one thing they could give?
So I think the easiest thing that anybody can do, and nobody's got an excuse for this, is when you come off court, is lay on the floor and elevate your feet so they're above the height of your heart, and just lay with your legs up for 5 minutes. That'll just help with clear out some of the waste products out of your lower limb. Okay, while you get your breath back.
Yeah.
And that's an easy thing to do. But then we need to think about hydration, and then we need to think about fueling. So getting some fluid down you straight away. So just water. Now there's been a good study actually that showed that beer is quite an effective hydration after sport. It looked at beer, milk, and a sports drink, and beer came out top, milk second, and the sports drink came out third.
Going through Yorkshire spirit now. Next thing you were saying it's tea.
Yeah.
Was this sponsored by a beer company?
Well, yeah. So it's so I tell that at rugby as well. They love it. I say, but it's only one. It's 1 pint. It's 1 pint of beer. That's it. Anything more than that, and any effects that you get, positive effects, we take
all
it away.
juniors listening, ignore that advice.
But get some water. Get a liter of water down afterwards, and then you'll be wanting. You've got there getting some carbs into you to fuel up, because it's a hard game. You'll be depleting your energy systems within your muscles, so get some carbohydrates down you. And then stretching after you have played is good, because you're warmed up, and as I said earlier about that, if you stretch, it can lead you to be more susceptible to injury. So it's a good time to work on that. But doing dynamic movements rather than static stretching, yoga type stretching. And again, if you've got the luxury that you've got you've got a theragun, or you've got somebody who'll give you a massage, that's good. But compression garments, the Under Armour stuff, or all the other compression bits, they're good afterwards to help clear your sort of vascular system of that waste products, because your muscle systems are still working and churning out waste products long after you've stopped stopped training.
Is there a bit of new research on the compression garments and ice bath on it actually kind of stops you progressing or stops you building muscle? So the compression garments, ice baths are better when you are actually in competition rather than in training. Is that true?
That's perfect. Yes. So when we train, and we do any train, we are creating adaptation. So basically, we're overloading their muscle system or their respiratory, physiological system, and they will. So we cause micro damage. And then the body over the next sort of 48 to 72 hours will rebuild and make it a little bit more efficient. So if you're training, like doing a gym session, then you don't want to be doing an ice bath, because that will blunt that adaptation. But after you've played a game, and we're going to get some changes and microscopic tears in the muscles and things, then an ice bath after that is a valid thing to do.
Perfect.
Interesting. And what's your take on some of those percussion instruments like the theraguns and so on? Do you think those are valuable just to get some of the vibrations with almost like a scraping concept alongside?
So again, there's many things. Again, all the evidence that I have seen up to date about massage is anecdotal. They've not been able to really show a change, but that's fine. People feel better. We can change. We can change how tissues feel after a massage. We can change range of motion after that. But it's one of those things that physiologically not really that people been able to measure. So sort of massage is a good thing. And whether that's having somebody do it to you, whether you use the what are they called? The inflatable sort of leggings.
Like the Normatex sort of stuff.
Normatex stuff.
Yes.
Yeah, other things like that are available. Yes, yeah. With it, yeah. So so whether you use that, what I like about the tool, like the Theragun and things, one of the side effects that it's not really being promoted by those companies is vibration is a very good stimulus to muscle tone. It can increase muscle tone at the right time, and it can decrease muscle tone at the right time. So using whether Theragun or the other bits and pieces that are around there, can help.
Very interesting. I find whenever I use the Theragun, well, not every time, but a lot of times after I use the Theragun, my legs feel lighter when I finish using it. Now that could be an N=1 personal sort of experience just because of the way it works for me. And I've tested many experiments. I'll only use it on one leg and then I won't do it on the other, and I'll get up and I'm like, wow, I can actively feel. Now that could be placebo because I know I've done it on the one leg.
That's fine, but that's what it's about. It's as I say, it's anecdotal, empirical evidence. With it, we can't find anything that definitely says what it does. But for 1,000 years, people have been using it, and we still use it. And people swear by it. But we say it does work. We just can't measure it.
Right.
Yeah,
and this is one of
those really tough, isn't it? To you can't measure how you would have felt. That's the trouble. So you're like, yeah, I feel great. I'm a 6. I was an 8 out of 10. Now I'm a 6, and you can't prove that you wouldn't have been a 6 just because of the rest anyway. It must be really tough.
Yeah, with that, it will be it is about getting people to do it themselves. So foam rollers, as I say, whether by Normatec pants, whether whatever they use, it's them being responsible for sorting that out themselves rather than wanting somebody else to do it, because there's limited amount of people available, and you can't have somebody with you all the time after you've trained or played really with it. So get into that habit of some post exercise, post match recovery strategy. It is really, really useful.
Right.
And I know one last thing I wanted to quickly just circle back to for people listening around the alignment and mobility piece. I love your analogy of the car, and everything needs to be aligned well. Are there certain benchmarks? I know we also said hip extension for 140 doesn't make sense and so on, but are there certain benchmarks that people could aspire towards, maybe for squash, that will say, hey, if you can get a certain amount of dorsiflexion. I remember there was one test when I've gone to the physios in the past, they would kind of get me to go close to the wall, and then I would put my foot flat and I try to lean my knee forward. And the idea was, how much space can I get, if any, as my knee touches the wall, how far can my foot be from the wall? Are there certain things like that have shown to minimize risk of injury?
There are I can't think of somebody shoot me down now. I don't think there are any tests that we can do that will definitely say if you can achieve this, you won't get injured. So if you think of the tests that you were just describing, that knee to wall test, you can achieve that. So if you're going forwards and if you've got a stiff ankle, what you can do is your foot can flatten, your foot can pronate, that will give you a little bit more range. So your knee will get near to the wall, which is, if that's all you're looking at, it is fine. But that fact that your foot is pronating and flattening, that's changing the mechanics and the likelihood of your knee to move in. The best I can offer is looking lower limb wise for some sort of form of symmetry in ranges. But again, there will be some slight changes from hand dominance and things like that, because what one person has, in some of the sports, we've looked at some of the best athletes in the world and what they look like, and compared it to somebody who's not as good as there, to see if there's some fantastic thing we're missing, that they've got 10 degrees of knee hyperextension, and that's what's the difference between being good and great. I think it's knowing what your baseline is for whatever test that you're using. So whatever you need to wall, or your single leg, your single leg squat, or whatever it might be, and just consistently monitoring that, and certainly monitoring hip medial internal rotation of your hip, and just regularly checking throughout the week and pre and post training to make sure you're maintaining what you got, because it's these subtle changes that come on over time that when athletes get these non-traumatic injuries, and when we start to isolate things, let's have a look at hip medial rotation. Oh, look, it's 40 degrees normally, but you've got 20 degrees here, and that's just gone. What's happened is your body's now had to make some change somewhere else to cope with that, and that's why your pelvis is out, or that's why you've got low back pain, or that's why you've got sesamoiditis, or whatever. So it would just be constantly monitoring some tools. And for the shoulder, we look at this with this internal rotation. That's a good monitor for sort of how the back of your shoulders working. So that looking for that what we call glenohumeral internal rotation deficit, a GERD with it. And that's a nice thing for the shoulder.
Is that the further down you can get, the better?
Yes. So again, So you would again, for squash-ish, it would be pretty similar, because there's not an overhead. In tennis, what would happen is, on the dominant side, you'd have less internal rotation on the dominant arm, but more external rotation on the dominant arm, because of what happens in there. But as I say, there's not a massive amount of overhead in squash, so I wouldn't expect a big asymmetry. But it's a finding, getting baseline measurement of a few critical things. Looking at your active knee extension angle for your hamstring and things like that. So I'll probably get
even that exercise there, though, just like seeing myself do it on the video there. It's kind of like you can feel the back of your shoulder working, you're mobilizing, even if I don't know if that's good or not, or just
that's fine. I mean, getting down about 60, 70 beyond that is really, really good. Yeah.
Is that like what you just have to keep your elbows at shoulder level?
That's it, so keep it in line, and you're dropping down, So I'm a bad example. I've got about I'm just looking. I've got about.
It's got no shoulder range. Is this
Can you edit that out of me demonstrating it, please?
I guess the one question, and maybe I'm just constantly trying to pin you down here to give me some to-dos, but the one thing I guess from my own career, and I think probably we spoke about it at the beginning with the hip levels as they such, when you talk about a hip level, maybe you could just explain to people what hip levels actually mean. But my question is, if your hip levels are out, this is what I personally would feel. I would effectively normally, let me try and get this right. I feel like I might hitch up on my right side. Yeah, right. You're nodding. I'm taking that as a yeah. So hitch up on my right side, or maybe tilt slightly forward on one side. I've normally felt that into the right adductor. So what's really interesting is I knew as soon as my hips were out, my adductor felt like there was one specific line of adductor that felt like no wider than the width of my finger. It almost ran from my knee right up to adductor insertion, and it just went like a piece of rope rather than a nice piece of elastic. And I would just come in and be like, my hips are out, my adductor's gone tight, feels like it's going to snap. You guys would go, you're a million miles away from your adductor snapping, calm down. And basically sort my hips out, go away for a couple of days, foam roll, massage, whatever it was you needed, get your hips rechecked. job done, normally okay in a few days. Laura's overreacting again, or she's in super early for an injury that's not there. So basically my answer is I then went away religiously with this hip leveling thing that basically you gave me those exercises when I had to pull out of Cayman Islands 2 years in a row. I mean, who has to do that?
Okay, well, how bad's that? I know. Had insult to injury, definitely, with that one, yeah.
Yeah, the third year in a row was the World Championship. It was a 3-year deal. I missed the first two, and the third year was the World Champs. I made the final, my first final, so that's all right. But the three exercises that I still do to this day, if I am struggling with any sort of like pelvic lower back pain, are bird dogs, dead bugs, which we could obviously discuss a few of them, and I can do a follow-up video on some of those exercises. And the weird one that you had me laying on a Swiss ball, just my shoulders on it, just lifting one toe on one foot, one heel on the other, basically firing up multifidi muscles. Yeah. And so I guess I'm trying, you keep saying, pint of beer and legs up above your head, but I am going to nail you down to some exercises. Are they good hip leveler exercises? Are they just good back mobility exercises, just firing up back because there's a lot of that rotation?
So what they are, Laura, they are control exercises, and that's what it's all about. Okay. Yeah. So your bird dog, right arm out, hands and knees, right arm out in front of you, left leg out behind you. The purpose of that is to keep your pelvis and trunk straight while you do that. So
you're tennis ball on your lower back, isn't it, as well, which really helps not let it roll off.
Yeah, but similarly, doing the dead bug, which is the reverse. So with your arms up, knees up at 90, and going there, that ability to control your core pelvis when you've got a rotation component through there, and similarly the bridging with the heel lifts, looking at control. Control is, as I mentioned before, is the most important thing, and then putting it out. So balance, so standing on one leg with a slight bend in your knee, with your fingertips just resting on your hips, okay, and then trying to stand there without take your hands off your body, swinging your other leg about, and be able to stand there for about 20 to 30 seconds without falling over. It is a good simple test of proprioception, okay? And then if you can do that, then you repeat it with your eyes closed. And what you will find in a lot of people is when you close their eyes, their balance goes out the window.
Yeah.
Because in all our joints, we've got little receptors that tell our brain where our body is in space, but we will use our eyes all the time. And once you take somebody's eye out of it and their balance goes, that tells us that's a chance of being injured, because when you're running around a court for a ball, you're not orientating yourself to the dimension of the court. You're chasing for a ball. And then you might start to lose your balance a little bit, and if the receptors are not active quick enough in your ankle or knee or hip, then they can't right you into that position. So balance it would be another easy thing to do. So I think control exercise, just doing things under control, because as we explain it, there's a saying that you can't shoot a cannon from a canoe. Okay, but if you think about it, if you're on holiday, if you're on a holiday and you're at the side of the swimming pool, and in the about 1 meter in the pool, there's a lilo, and you're stood on the side of the pool, you can hop from the side of the pool onto the lilo, right? Yeah. But if you try to hop from the lilo back that 1 meter onto the pool, you're not going to make it, because you haven't got a stable platform to move off. So that's why stability is all important, because if you're stable, you are strong. Okay. And so thinking about doing things under control, challenging exercises, standing on a wobble cushion and doing mini squats, doing a lunge onto a wobble cushion, things like that, walking on foam pads. Yeah. That challenging your balance system, because that works really, really quickly. That will give us a stable platform to produce maximum force without having to recruit massive amount of muscle.
Yeah, interesting. And I know I can speak from experience that a lot of those, for anyone who we do follow up and do a little video on some of those exercises, they are quite boring. And in a lot of ways, you don't feel like you're actually doing anything. But what it does, it gives you an underlying balance and an underlying stability that allows you to build strength on top of that, doesn't it? And there's a reason that all the top pros do that. And then just going back to the hip, most people might listen to this and go, what, your hips can move or tilt or hitch? When you say hitch, like shorten up, what, from a physio perspective, what am I talking about there?
So that's the bit we'll call our pelvis. So the socket of where your thigh bone goes into there. So your pelvis is three parts. It's got these two wingy bits at the side, and then the bottom of the spine, which is the sacrum, the triangle bit. And then where the sacrum joins one of these wingy bits, you've got a joint called the sacroiliac joint. You've got one on each side. And when we're moving and walking, we get little bits. There's about 5 to 8 degrees of movement as you're walking. And what can happen is you can then get stuck, okay, in a rotated position. And it's generally the left side tends to be forward, and it's a relative thing, and the right side back is back.
And is it the muscles that fix that, or the joint itself?
So it can be a combination. So it's generally, once it gets there, then the muscles will spasm and increase the compression through there, so it can't come back. So if your left side is forward and your right side back, then your pelvis is turned to the right.
Yeah.
So then everything else is a compensation then. And as you were saying, you get one looks higher than the other because those wingy bits, the hip bit, which is called the innominate. So these bits that you put your hands on at your waist, because they're round, and when one goes forward, it's higher. It looks higher because it's a bigger arch on the back, so that'll be up from there, and that's the same. If you're boring people, but I'll go through the mechanics. When you do that, that's the same as being bent to your left.
Yeah.
Okay. And if you're bent to your left, also mechanics, your spine rotates to the right. So you've got a right mess going on around there. And so you don't walk around a bit like Quasimodo further up your spine in your thoracic spine. The opposite will happen. You'll side flex the opposite way and rotate the opposite way to straighten you up. So you've got two weird bits of stuff going on from there. So it's just this happens and then screws up everything with it. It also changes the orientation of the socket. Okay, so it just doesn't go forward. It moves in three dimensions, and you lose range of motion. You'll lose internal rotation when you assess it at your hip on the right hand side.
Yeah,
it's losing extension. So just this tiny little thing can screw up so many bits, and it's just a positional fault that you ended up there where you get more compression. It can't come out, and then you can do things to normalize it, and then you need to make sure that you can control that movement again.
Yeah.
That's interesting. I've had SI joints locked up in the past, and once you kind of get it released, then it almost like when you just kind of re-engage in your activity, you do some of the continual work, but then the body kind of remembers how to move again after that. Is it usually excess load that kind of locks the joint, or is there a known cause behind it, or
it's generally, if it's not traumatic, it's just poor timing. It's how the order in which the muscle fires. We're talking, hundreds of milliseconds, the timing, but in the right order to get things to happen. And if that doesn't happen, then it screws up the recruiting pattern, and the wrong muscles contracting at the wrong time. The other thing that goes with that is you can have laxity, which is more common in different parts of the menstrual cycle in females, but also in pregnant women as well, where their pelvis starts to open and prepare to accept a growing baby in there. So we can have a laxity so the two bones should be together, sort of they're rough on the inside, and that should hold them together. But if the ligament gets lax due to hormonal changes, then they're not together, and that will allow a little bit more.
Interesting. Yeah, I mean, it's just some of those exercises that we just went through, some ways to try and keep the pelvis stable. Again, just underlying stability work. And so for people who are feeling that, I mean, obviously, you're probably going to initially need a physio to kind of try and loosen off some of that the compensation from that tilt. But once you've got that ability to just keep working on that pelvis stability with strength around the hip and some of that lower back work and maybe some trans ab work, like the
definitely trans ab, pelvic floor, all those bits, and a little bit into breathing. But yeah, so if you think about it, one of the tests that we do, we'll manually compress somebody's pelvis when they're doing a test, and if it's an instability, when we compress and give them stability, the test, we look at them lifting their legs up when they're laying on their back and saying, do they feel the same weight? And if we've got a bit of instability, one of them will feel heavier than the other. If we apply the right compression, then my legs feel the same. So that without hands, you've got core, whatever you want to call it, transversus abdominis at the front, glutes a little bit at the back, and just getting those to work a little bit in the background. So it's not strength, it's giving that just a little bit of a hold, working at 25 to 30% maximum. So teaching low level recruitment with function as well. So getting to switch on and then be able to do it while they're doing bird dog, or when they're doing the dead bug, or doing a lunge or whatever.
Yeah.
Interesting. Right. Well, so much of this there's so much body awareness required for this as well. Is there a resource you would recommend to people to say, here are some really, really good, and you can get back to us on this and we can post it later, but something that would teach people exercises, but also understand how to do an exercise, and what to feel. And then the second part of that is, for anyone in the UK, do share your clinic's location so people can come see you. Because I feel like this stuff is hard to figure out by oneself.
Right. So as coincidence have, I have books everywhere. Right. So this book by a colleague of mine called Joanne Elphiston is a good way to look. It's a well-written book, but also if you look on the internet for Joanne Elphiston, she's really into quality of movement. She's a physiotherapist, Australian originally, hopefully Australian. Hope I'm not upsetting you, and you are New Zealand. But she's been over here for ages, and Joe's brilliant at talking about beautiful, effortless movement, and has influenced me massive. So this is stability, sport, and performance movement. It's a nice book that sort of explains in much more eloquently than I've done about what we're looking for with it. So yeah, check out Joanne Elphiston on the internet. She's got some good stuff going on. She's got some online courses as well.
Amazing.
I'll have a look at it. Probably just one last question, Ian, because I feel like I have to ask this. Well, a little two-parter. Number one, you've been to some unbelievable sporting events with some unbelievably high-profile athletes. Have you got one memory that sticks out with either an athlete or an event? And secondly, how much, which is sort of tied in a little bit, how much of being a physio is like being a therapist? I mean, I can give you so many stories where I've been in tears and I need no treatment. I just sit on the bed, and you must have had so many stories. I guess it's like almost in a way the low of the what's your high, and it's not a low for you, but it's sort of like I can only say I think it might have been Glasgow or maybe even 2018 Commonwealth Games. Jade, I've never shed as many tears. Commonwealth Games were always my real Achilles heel emotionally. I didn't have my team around me. I was I was away with England. I didn't have everything that I really felt like I needed. That pressure of competing for England was totally different. And I spent a lot of the Commonwealth Games, more than any other event, an emotional mess, really. So have you got any good stories from that front?
I think I've got, like, you're right. I've been so lucky. I've worked with England rugby. I was around when we won a World Cup. I've worked with England football. Toronto Wolfpack, the first transatlantic rugby league team in the world. That was amazing. But I think because it's the way I changed the direction of my career, it'll have to be London 2012 Olympic Games. It was always something I wanted to do, and I applied for several previous games to be part of Team GB, and kept getting told I didn't have a broad enough spread of sports in my background to be considered. And it was then I decided then I would go and work at the but as then was English Institute of Sport, and my plan was it was 2008, so I went to work there just as the Beijing Games was on, thinking, right, so if I can get selected for the 2010 Commonwealth Games, so a senior multisport games, that ticks a box for me to be considered for 2012.
Yeah.
And I was lucky after a couple of hiccups to go to Delhi in 2010 with Team England, and then got selected for London in 2012, which was, great. It was a great games for anybody who went. Even to any athletes saying about that, but it was my first games, home games. The fact that my family could come down as well, it was great. So that was probably would be my greatest thing, because I'd focused everything on doing that. And if that hadn't have happened, I probably wouldn't still be at the institute, and I'd taken a different path.
Yeah.
And then the therapy bit, it's we were quite privileged as physio, because we're close to our athletes. It's a touching thing. There's trust. They're half undressed half the time when we're teaching, and I treat Laura loads. Obviously she's a woman, and there was no any issues about that, because it was just trust. It was professional things, and often when you're with athletes and they relax and they trust, things will just come out in general conversation about stuff that's going on at home or in their life, and those stresses can affect performance, and sometimes pre-competition, if they've got some anxiety, it sometimes manifests itself as an injury, and they'll come in, I've got a bit of a tight hamstring, and that ability to check that they haven't, but then be able to properly reassure them by saying, doing tests and stuff, rather than say, don't be daft, just get out there, but be able to go through the right thing and sort of talk them down and say, look, we've done this test, we've done that test, how's that feel? Get back in. So there is a lot of therapy has been a physio. A lot of it is talking to them and finding out what's going on, their fears and anxieties, and not BSing them. But from there, it's when it's the right thing to do. Sometimes at some points it's right. Well, there's nothing wrong. We can see that you agree, I agree. Or sometimes look, you're just going to have to toughen up. Right? It's not perfect. You've got two options. Yeah. You either pull out or you get on with it. From there, but what it is, I'm not going to let you do something that's risky if I think you're going to get a bigger injury and it's going to change things. But at the moment, it's a little bit of a tweak, but on the balance of probability, you'll be fine. Just ignore it, get out there.
And again, that totally comes from trust as well, doesn't it? I remember that's probably only happened once in my career, where I tweaked my calf and had the British Open, and I'm like, I can't, I've got no confidence in my calf, I can't push off, I need it for, push for the tee. And I remember playing my first round, and I scraped through by the skin of my teeth. And I remember Jade just going, just pull out if you're going to play like that again, because you've just made it through a match and you've got through and there's nothing wrong. Like in other words, pull yourself together. But that came from a huge amount of trust, of years of her listening to me, and the same with you. And I think as well, it's fair to say that really good physios have a really nice, a certain demeanor where there's authority there, but there's also an understanding and a calmness. Like I said in my intro, you were able to calmly tell me to get on with it, or calmly tell me to pull out. And it was, without this sounding horrible, it was like very not emotionless in a way. And like, I'm not invested too much in your emotions here. I'm just giving you the facts. And there's a huge amount of respect there. And the fact, as an athlete, you don't want any your physios to be panicking, do you? That's the problem, I guess. So,
and if you work with athletes regularly, you can tell when there's something going on behind their eyes, in their head, just from the way and sometimes they won't be saying anything, and sometimes you'll just get them in a corner and say, "Come on, what's wrong?" This is not, this is not you. I'm watching you warm up. You're cocking it all up. What is it? Your head's not in their game. What is it that's that's going off? Is it, is it something outside? Is it, is it something that you're feeling? And that's good with it. And sometimes, like Laura said, sometimes you just want to come in and just unload because they've had a shit day. Okay, stuff's gone wrong. And they're falling out with somebody, and whatever, in an hour session, they've got it all off the chest, and they just feel better.
I just left you with a mess.
yeah, that's it. Yeah.
Sorry about that. No, that's brilliant, isn't it? Have you got a question I had, or are we good?
No, I think we're in a good spot. Yeah, this is great, Ian. You've shared a lot of knowledge and experience with us. No, I really appreciate it.
That's
Been
good. No,
fantastic. Right, I knew we'd have loads to chat about, so thank you so much for giving up your time.
no, thanks for the opportunity. As everybody knows, any time talk about physio, I don't mind at all. So that's good. I hope it's been useful for everybody.
Quick interruption, everyone. Just for a minute, I promise. Have you ever felt stuck in your squash? Are you training hard, but you're not sure if you're working on the right things to actually get better under pressure?
That's exactly why I created a new online coaching community. Unlike other programs that give you just drills, we give you a framework so you know exactly what to work on, why it matters, and how to hold up in real matches.
Whether it's finally breaking through a plateau, structuring your solo practice, or joining us live each month for group coaching, this community is designed to take the guesswork out of improvement. If this resonates with you, please send me an email at ahad@arperformance.com. I will personally help you see if it's the right fit. Thanks for listening to Between the Lines, where world-class insight fuels the squash journey that never ends. If today's episode helped you grow, please share it with someone in your squash circle and join our community online. Until next time, keep learning, keep growing, and stay in the rally.